Recently, Health and Human Services Secretary Sylvia Burwell visited the Stephen Klein Wellness Center in Philadelphia. She toured the facility, spoke to some of those people that use the facility, held a brief press conference, and gave WURD an exclusive interview about what she will focus on that will affect the African American community during her last 2 years as secretary.
Most will pay some, but probably the thing that is an important measure is right now 87% of the people that are part of that 6.8 are people who have received financial assistance.
Now, you have 2 years left of the Obama administration. You're currently HHS secretary. What are the things that you see that are on the plate that could possibly affect African Americans or all Americans over the next 2 years?
So I want to focus on the biggest one that's a very important one, and that's health disparities. In the African American community, what we know and what we see is there are disproportionate numbers of things like diabetes, heart disease, and even more deaths by breast cancer. And so what we want to do is make sure that we're reducing those disparities. And step one is to get people access to quality care, where they have essential health benefits, where they can make sure that they're getting the preventative care they need to prevent that diabetes, to prevent that cancer in terms of getting in front of things, catch things early. And so that's probably the single most important thing. I would also focus on our programs in early learning. Folks know Head Start is part of HHS, and making sure that we're training our young people, getting them started with early Head Start, that kind of education that they need. I have a 5- and 7-year-old, and I know what early learning is about every day at home, and I do it at work. And so that's another place that I think will disproportionately help and impact the African American community. So those are two of the big areas, but we work across, what I like to say, we work across the entire kitchen table. And whether that's the Administration for Community Living, which is helping us all deal with our elderly parents, another issue because the African American community is dedicated to its elders. And so there are a number of things throughout the department, early learning, healthcare, but it's across the wide spectrum, and that includes issues of behavioral health and making sure that our mental health is of high quality too. So we try and do it all.